Let's talk about 5 mental health concerns that I commonly see occur with neuroplastic pain or mind body concerns. It's really important when you're trying to recover from neuroplastic pain or mind body concerns to also consider where your mental health is at. Personally, I've struggled with my mental health throughout my life. And when I was trying to recover from neuroplastic pain, and in that process at first, I really needed to also work on my mental health and improve the symptoms that I was experiencing. Because overall, remember, we're working towards safety. We want to reduce fear and despair in our life and feel safe in our body, not just with the pain sensations, but with all sensations, including emotions or anxiety. And so, as we're trying to recover from neuroplastic pain, we need to consider our mental health. And when I'm assessing someone new in treatment, I'm very careful to assess their mental health as well, not just their pain symptoms, and understand what also needs to be included in their treatments so that we can maintain recovery from neuroplastic pain. So let's get into this list of 5 mental health concerns that I commonly see occur with neuroplastic pain or mind body concerns. Number 1, anxiety. Anxiety, just like pain, is also a danger signal that our brain sends us when we feel an emotional danger. And anxiety puts us into this fight, flight, or freeze response. Now, anxiety is the most common type of mental health concern that people experience. And there's a lot of different anxiety disorders. There's generalized anxiety disorder, social phobia, separation anxiety, panic disorder, illness anxiety disorder. And regardless of what anxiety disorder you might be experiencing, a lot of times with neuroplastic pain, we know that people commonly experience anxiety. I would say almost everyone. Because remember, neuroplastic pain occurs in an environment of fear and comes with an element of hypervigilance. And so for myself, I've experienced anxiety throughout my life. And it was really important that I learn how to attend to anxiety in my body, befriend the sensations, and work on reducing high alert behaviors in my life that were escalating me feeling anxious. Because otherwise, what will happen is people will have anxiety, this danger signals being sent, and all of a sudden, pain will increase. And then as the pain increases, we experience more anxiety, and more anxiety comes more pain. And it's kind of this pain fear cycle that we end up in. And so when we're recovering from neuroplastic pain, we need to learn to befriend the anxiety that we feel in our body, learn to sit with it, get exposure to feeling safe with it, because over time, this is what will cause it to start to reduce. And I can't say this enough. It's really important that we start to reduce anxiety in our life as a whole so that we can maintain recovery from neuroplastic pain. So often treating anxiety at the same time as neuroplastic pain is really important. Number 2, depression. Oftentimes, neuroplastic pain comes with an element of depression. And when we feel depressed, our mood is low, we lack motivation, we lack interest in pleasurable things, we feel hopeless, we have low energy, and our thoughts can become really distorted. And depression, just like anxiety and pain, is a danger signal that our brain sends us when it feels an emotional danger. And oftentimes what I'll see is people feel defeated in life. And when we feel defeated in life, we get these depressive symptoms starting to occur. And the issue here is that neuroplastic pain and depression have amplifying effects on each other. Because the more despair or low we feel, especially about our pain, the more the brain feels in danger and then produces more pain. And then more pain makes us maybe sink lower and feel more despair, resulting then in more pain again. And so we need to treat depression as well when we're trying to recover from neuroplastic pain. And for myself, I remember when I was in severe chronic pain and barely able to move my body, I felt really depressed. Without a doubt, I was in a depressive episode. And to recover from this, I needed to also treat the depression. I needed to start to challenge and change my distorted thinking. And I needed to activate, my mood by doing, useful behaviors, behaviors that gave me pleasure or gave me achievements. And then I also need to feel safe with the sensations of depression. And so when I'm treating someone with neuroplastic pain that is experiencing depression, I'm including these elements into it to help treat both these danger signals at the same time with the hopes of reducing them. Because with pain reprocessing therapy, yes, the end goal is to have great reductions of pain symptoms or elimination of pain symptoms. But like I said, we also need to reduce all danger signals being sent and actually start to feel safe in our body. So receiving treatment for depression is really important while we're trying to recover from neuroplastic pain. Now I'll state, for a second here that with depression often comes suicidal thoughts where we want to die. And I remember being there and struggling with this. And if you're experiencing this today, please make sure you reach out to support, talk to family members or friends, call a crisis line, or in more extreme situations, go to a hospital emergency room. Because the best thing we can do when we're experiencing suicidal thoughts is making sure we talk about it. So depression is kind of the second mental health concern that I commonly see occur with neuroplastic pain. Number 3, trauma. Trauma can cause really severe neuroplastic pain or mind-body concerns. And when we think about trauma, it's often talked about as PTSD or post-traumatic stress disorder. And what occurs here is people experience a life-threatening situation or witness someone else in a life-threatening situation. And then you get symptoms such as flashbacks, nightmares, hypervigilance, a negative affect, and an avoidance of anything related to the trauma. Now I think more about trauma as anything that causes us to feel really unsafe and pushes our nervous system past the point of what it can deal with. And so think about, childhood adversity, whether it's abuse or neglect, or whether it's just in childhood, you felt really unsafe. Like for myself, I came from a really good home, but I experienced a lot of bullying from my peers growing up. And as a result, I just viewed the world through a lens of danger. And then later on, as I moved into adulthood, I was still viewing the world through a lens of danger, even though now I was actually safe. And this occurs with trauma. Our nervous system gets stuck in danger mode. And then we start to get neuroplastic symptoms later in life. And so it's really important to treat trauma as we're recovering from neuroplastic pain because we can't chronically be in danger mode all the time if we want to start reducing that danger signal of pain being sent. And so there's a lot of different ways to treat trauma, but I highly suggest that if you've experienced trauma or severe childhood adversity, that you receive treatment for it, as this can help our recovery from neuroplastic pain or mind-body concerns. Number 4, OCD and OCDD. Now these two get confused amongst each other. OCD is obsessive compulsive disorder. And what you need here is you need two things. You need obsessive thoughts about a topic, and you need these compulsive behaviors that come along with it. So a lot of times OCD can be about germs, where people are obsessively trying to think about germs, make sure that they're clean. There's this really intense obsession about it. And then comes compulsive behaviors along with it, where they're compulsively cleaning or they're compulsively washing their hands constantly throughout the day. Now, OCD really, common to occur with neuroplastic pain in my own experience working with people. And this makes sense. We are often obsessed about our pain symptoms. I think at the worst of it, I was probably thinking about my pain 80% of the day. And then a lot of times we have these compulsive behaviors that come along with this obsession, where even for myself, I would constantly go like this, checking for my shoulder and arm pain, just throughout the day, constantly seeing where it's at. And so, OCD, and neuroplastic pain, I think can be really closely linked in how they kind of function. And, of course, when I'm treating someone with pain reprocessing therapy, we're working on reducing the obsession about our pain. We're working on reducing the compulsive checking and always checking in with our pain, seeing where it's at. And so, pain reprocessing therapy, I think, does a really good job of treating neuroplastic pain and the obsessiveness that comes along with it. Now, OCPD is something different. This is obsessive compulsive personality disorder. Now, I don't love this diagnosis. It makes it feel really absolute. But, how it's defined is OCPD is this pervasive pattern of perfectionism, of rigidness, of always needing things done a certain way, and a lot of times can be this extreme orderliness. And people with OCPD tend to be workaholics and excessively productive all the time. Now, as we know, with neuroplastic pain or mind body concerns, really correlated with perfectionism. And so, perfectionism, it's not really a personality trait. It's more of a coping mechanism we develop in childhood when often too much pressure is placed upon us. And so, reducing our perfectionism, reducing the pressure we place on ourselves, the self-criticism and the worrying that comes along with it, can exit us out of danger mode. And for myself, it was really important for me to reduce my perfectionism for my pain symptoms to reduce. And even in my life now, if I get too perfectionistic, if the pressure builds up too much, then all of a sudden I'll start to get these neuroplastic symptoms. So OCD and OCPD is kind of the fourth mental health concern that I often see occur with neuroplastic symptoms. And it's really important to treat this and see improvements in this way for, to see recovery from neuroplastic symptoms and to maintain recovery from neuroplastic symptoms. Number 5, eating disorders. I've often seen a connection between eating disorders and neuroplastic pain symptoms or mind-body concerns. And with eating disorders, they commonly occur due to body image issues and due to a need to control something. And a lot of times, what we're trying to do with our eating disorder is avoid feeling the way we feel underneath. And for myself, I've struggled with my eating, especially earlier in my life. And it was out of a need to avoid my emotional state. A lot of times, shame. I was, engaging in, disordered eating because I wanted to avoid feeling a certain way. And this is why people often will engage in restricted eating, binging, or purging behaviors. And with eating disorders, our relationship with our body becomes really negative. We're almost constantly fighting against our body. And, you include our relationship with our body becoming really distorted, and then you include us constantly resisting trying to feel a certain way. I think it can be a really nasty combination for chronic pain symptoms, for neuroplastic pain symptoms to start to occur. And so receiving treatment for an eating disorder is really important when you're recovering from neuroplastic pain, because we need to change our relationship with our body. We need to accept, ourselves as we are and learn to feel safe in our body again. And so receiving treatment for an eating disorder is really important as we start to recover. So these are the 5 mental health concerns that I commonly see occur with neuroplastic pain or mind-body concerns. I hope going through this was helpful. If you guys have questions or comments, please put them down below. Hit the like button and subscribe to my channel, as I'm going to release videos every week talking about neuroplastic pain and mind-body concerns. Take care.